all the senses that God has given us, vision is one of the most important of them all. Just imagine closing your eyes and walking through a road. How difficult would that be? Vision is the most important God given gift. And vision requires a very complicated apparatus. Even though it looks very simple to eyes looking out, it has a wonderfully transparent cornea and a transparent lens and a transparent vitreous through which the light passes and focuses onto the retina. It's just like a camera. The lens of the camera is akin to the cornea and the lens, and the film of the camera is akin to the retina, and the light gets focused into the retina, and there are a lot of chemical changes which occur into the inside that retina, and then signals as electrical impulses go to the brain and to the brain association areas all over the brain to give a wonderful vision and your understanding about what you are seeing, your relationship with that person, etc., etc. Now, vision is something which is priceless, as I said, which requires to be kept. Anything, any small thing that you buy from the market, you keep on servicing it. Like that, an eye also requires service. At this point of time, there are about 300 million people in the world who are actually having low vision, out of which about 40 million people are completely blind. And if you look at the blind people, 1 out of 3 blind people live in India. And that is something that we require to look into. If you look into those diseases, 80% of these blindnesses are preventable. That's the basic crux of it. So if you treat in time, if you detect in time, probably you could prevent blindness in a lot of people. So let us just look at what are the causes of blindness all around. One of the common things would be a refractive error, which means that there's a power of glasses which we have to wear in order to see clearly. So a lot of people, when they are of the school-going age, actually finds out that they are not able to see the blackboard clearly or they are not able to read clearly, and those are the people whom, if you use as spectacles, you will be all right. But there are lots of children, even now, who do not have the luxury of going to a hospital nearby to check for glasses. So, a school screening program is what the government has imposed so that at 5 or 6 years of age, you have all the children go through a visual examination, and if the visual acuity is not as good as what it should be, then they go through a process called refraction, whereby we find out the power of glasses. Next in, we have the diseases which affect the transparent areas like the cornea, the lens, the vitreous, etc. If there is a problem of the cornea, just like if you have a problem of the lens of the camera, you have a blurred vision. What are the problems like that? Vitamin A deficiency, which is a common thing, common disease which may occur in some of the low socioeconomic status, or corneal ulcer, or a corneal opacity, corneal degenerations and dystrophies. These are all conditions which actually cause loss of transparency of the cornea, which can cause a problem. How to manage? If there is a significant opacity, you may require to transplant the cornea, which means that if a person donates his cornea upon death, that cornea can be harvested and implanted into the person who has the disease. Now, coming on further, cataract is one of the most common causes of decreased vision all over India. It's if there are 100 or 100 blind people in India, out of which about 70% would be caused by this cataract. The lens, the natural crystalline lens which God has given us, is completely transparent. And as aging changes occur, some of the proteins get denatured and there will be opacities developing in the lens. And these opacities is what is called cataract. And what do you do for cataract? You have to remove the opacified lens by a mechanism called phacoemulsification. It's a fairly simple surgery. It's like a pen, and you make a small incision about 3 millimeters in size. You do the phacoemulsification, remove the lens, and put in an acrylic or a plastic intraocular lens inside. So that is cataract. The other important cause of permanent blindness, if not treated in time, is glaucoma, in which the pressure inside the eye increases. And once the pressure inside the eye increases, the optic nerve is damaged. And as the optic nerve is damaged on and on and on, the field of vision, which is what we see on the periphery, slowly gets constricted and constricted and constricted, finally making us a tunnel vision. And this tunnel vision is the final endpoint of glaucoma, after which there will be sudden loss of vision. If you find out that this guy has glaucoma, you have to treat them with anti-glaucoma medications or sometimes with a surgery called trabeculectomy in order to actually prevent the glaucoma, the pressure related damage of the optic nerve. Next on, we come to some of the retinal diseases which cause decrease of vision. One of the most common retinal diseases is diabetic retinopathy. You know that 1 in 5 people are diabetic, and if you look at population more than 40 or 50 years of age, more than that. In India, maybe 1 in 3 is a diabetic. And most people with diabetes more than 10 years of duration or 15 years of duration have significant problems. WHO in its statements said that after 15 years of diabetes, about 2% can go blind and about 10% can cause severe visual impairment. And all of this is preventable if you control the diabetes and have regular checkup with a doctor. Diabetic retinopathy moves through mild, moderate, severe, and very severe non-proliferative diabetic retinopathies, which are the earlier stage, and then move into more serious proliferative diabetic retinopathy, which can suddenly bleed inside the eye and cause complete vision loss. So this diabetic retinopathy, if you pick up in time, we can treat the diabetic retinopathy. We could do laser, we could do intravitreal injections to reduce the edema or reduce the neovascularization, the bleeding areas, and then go on to have a normal vision for the rest of their lives. If there is a bleeding or a traction retinal detachment in a diabetic retinopathy, you may require to undergo a surgery called vitrectomy. Another problem which is on the increase right now in India, basically because the age of the population itself is increasing. Like 20 years back, our average life expectancy was much smaller, smaller than what it is right now. And as the population is aging eye diseases increase. And how does aging affect the retina? What happens is there is a pigment epithelium, the retinal pigment epithelium, which acts as scavengers. They are the cells which take care of all the waste products in the retina. As the light comes and falls into the retina, what happens is there is a lot of chemical reaction which takes place, and the rhodopsin, which is there in the retina, gets converted into lumirhodopsin, metarhodopsin 1, metarhodopsin 2. This visual cycle will produce a lot of waste products. And waste products like these, pent up to form lipofuscin, and this is separated from the eye, which is segregated from the eye by retinal pigment epithelial cells. With aging, what happens is these retinal pigment epithelial cells slowly say, oh, I'm old, I will not work. And that's the point of time when all these waste products start getting accumulated there. And as the lipofuscin gets accumulated, there is what develops, which is called dry AMD. Dry AMD or age-related macular degeneration is a condition where there are multiple drusens. Drusens are these lipofuscin-laden cells which are seen on the center of the retina, the central area where the light is focused. That area is called the macula. So in the macula, when there are these lipofuscin deposits, it's called dry AMD. And these dry AMD, because of passage of time, what happens is this thickening of the retinal pigment epithelium will cause some lack of oxygen to the retinal cells, and that gives a stimulus with a chemical messenger called vascular endothelial growth factor. And because of the vascular endothelial growth factor, new blood vessels start sprouting from the layer which is just beneath the retina, which is called the choroid, and it will grow into the retina. And these new blood vessels will start bleeding. And that's the point where the dry AMD shifts itself into wet AMD. So once there is a wet AMD, there is a significant drop in vision. Fortunately for us, if you take 100 AMD patients, 90% of the patients are having dry AMD only. Only 10 patients per 10% of the patients are having wet AMD. But if you look at vision loss in AMD, 90% of the visual loss is caused by wet AMD. So that's the basic problem. So in dry AMD, you can give some antioxidant, vitamins, vitamin A, lutein, zeaxanthin, etc. to actually prep up the retina so that there is not much damage occurring. But the moment the tide swings towards wet age-related macular degeneration, there is edema, there is fluid at the center of the macula, and often bleeding starts occurring at the center of the macula. And when that process occurs, you may have to treat them with intravitreal injections. There are multiple intravitreal injections available. One is called Avastin, otherwise called bevacizumab. The other one is called ranibizumab, otherwise called Lucentis or Accentrix in India. And there is something called aflibercept or Eylea. So these are some of the common intravitreal injections which are performed inside the eye. The basic problem in age-related macular degeneration is aging keeps on increasing and the disease also keeps on increasing. And as the disease keeps on increasing, you may require to repeat these injections. So the general strategy that an ophthalmologist will employ is to find out whether there is a wet AMD which is there by doing certain tests called the fluorescein angiography, indocyanine green angiography, and a scan called optical coherence tomography. Find out, characterize the choroidal neovascular lesion in an AMD and find out whether there is a wet component in it. As soon as there is a wet component, you have to start treatment with intravitreal injections. And many of these intravitreal injections may require to be repeated on a monthly basis. Most of us use a 3 injection startup phase in which initially every month we give injections for at least 3 times, re-evaluate these patients and find out if we can slowly extend the treatment a little bit more. Like after 3 monthly injections, we may try to inject less frequently, maybe once in 2 months, once in 3 months, and then slowly wean them off treatment. The problem with wet AMD is that even if I treat that wet AMD right now and the patient becomes stable, as the age progresses, at any point of time, wet AMD can recur. And whenever wet AMD recurs, you may have to find it out at the exact time so that you treat it. What is the problem if you do not treat wet AMD? Basic problem is as it bleeds, then it will scar. The central retina will have a scar if you don't treat. So once there is a scar, there is no going back to good vision. Once there is a scar, whatever the patient sees on the center, there will be a big black spot. If you look at a face, that face will appear dark. If you look at a word in a book, that word will appear dark. All around you can see, but the central area will become completely black. So, wet AMD is a disease which will require a long-term monitoring mechanism. So, what can be done to actually prevent AMD? One of the important reasons for AMD is aging, and it is not easy to prevent aging. Obviously, there are no anti-aging treatments. So the only things that we can do would be one, to stop smoking, maybe keep your cholesterol levels low, having a cardiac system which is quite okay, and probably add antioxidants and vitamins into the diet. So antioxidants are chemical substances which prevent oxidative damage, like vitamin A, lutein, zeaxanthin, zinc, selenium, copper, etc. There was a large study called age-related eye disease study in which they said that taking these vitamins and minerals can actually help us in the advanced stages of age-related macular degeneration. Now, another important thing is to time the intervals and time when the patient has to see the doctor. Generally, all school children, as I said, by about 5 or 6 years, should definitely have an eye checkup, a vision checkup, to see if there is a decrease of vision. And if a simple thing like a glass can prevent further visual damage at that point of time, that will be great at that point of time. Then if things are all right, maybe by about 30 to 40 years of age, when you suddenly start getting the presbyopic symptoms, like it's slightly difficult to read at near, you'll have to keep on moving it. That's a point of time where the patient will get another eye checkup, and that's a point of time when you can rule out glaucoma, diabetic retinopathy, a lot of other diseases. After that, a little more periodic checkups may be necessary depending upon the eye finding and depending upon what is advised by the ophthalmologist. Generally, 3 or 4 years interval, you should get a good eye checkup. Look at visual acuity. Is there any drop in visual acuity? Is there development of cataract? Is there development of glaucoma? If there is a retinal problem because of diabetes, is there any other age-related changes, etc.? These are the things that you look at on all follow-up visits. With good care of the eyes, with good service rendered to the eyes, with frequent follow-ups with ophthalmologists and frequent eye examinations, maybe once in a year, you can prevent a lot of these complete blindness. Imagine closing your eyes for a minute and looking outside. That is what a blind will feel. And definitely, it should be our prerogative this World Sight Day to say that at least I will get an eye checkup done this year, and I will also get my family get an eye checkup done this year so that we can prevent a lot of preventable blindness.